This video is for informational purposes only and is not a substitute for medical advice.
Today I'm going to monitor my patient's vital signs to ensure her safety while we work together. First, her blood pressure.
Normal blood pressure in adults ranges from 90/60 to 120/80. 140/90 is commonly considered the beginning value for hypertension. Remember, healthy older adults are more likely to have higher resting blood pressure. You should not have your patient exercise if their blood pressure is 200/110, and should cease exercise if their blood pressure reaches 250/115. Sources will likely vary in dangerous ranges for blood pressure, so it's important to use clinical reasoning and to look at your patient. Distress signs due to dangerously high blood pressure include shortness of breath, headache, nausea and vomiting, chest pain, and unresponsiveness. Some patients may have low blood pressure, which may be caused by certain medications used to treat different cardiac conditions. Medications like beta blockers, vasodilators, and nitrates can cause low blood pressure that may cause dizziness, loss of color in the face, or weakness with positional changes. If your patient is taking these types of medications, it will be important to monitor their blood pressure throughout your therapy session.
And now for her heart rate.
For adults, normal heart rate values should fall within the range of 60 to 100 beats per minute. If heart rate is lower than 60, it's referred to as bradycardia and may be indicative of coronary artery disease, myocardial infarction, endocarditis, myocarditis, or an electrolyte imbalance. It may also be normal for that patient, perhaps because they are on beta blockers or they are a highly trained aerobic athlete. So it's important to take a thorough history to determine if this is a problem. If heart rate is higher than 100, it's called tachycardia and can be indicative of hypertension or hypotension, arrhythmia, and many other heart conditions. It also puts the patient at greater risk of stroke and cardiac arrest. It may also be normal for that patient, so once again, take a thorough history.
And now for her respiratory rate.
Normal adult respiratory rate is between 12 and 20 breaths per minute. It's also important to look at how your patient is breathing. Rapid, shallow breaths may indicate anxiety or difficulty breathing, and slow, labored breaths may also indicate distress. Faster than normal breathing is called tachypnea, and slower than normal breathing is called bradypnea. It is normal for respiration rate to increase with exercise. As usual, continue to use clinical reasoning and look at your patient.
And now for her oxygen saturation.
Oxygen levels can be taken either on the finger or earlobe. Patients with cold hands, poor circulation, or nail polish may need an earlobe reading. An oxygen level of 95% or higher is normal, and below 90% is a concern. If your patient presents with an oxygen level below 90%, action needs to be taken. Pursed lip breathing or producing a good strong cough can be effective ways to raise oxygen levels. Pursed lip breathing forces a longer exhalation, therefore increasing time for oxygen exchange to take place in the body. The deep inspiration required to produce a cough moves air deeper into the airways, allowing for better gas exchange. If these techniques do not raise oxygen levels, consider contacting the patient's nurse and cease exercise.
And now for her level of pain. On a scale of 0 to 10, 0 being no pain, 10 being the worst possible pain, what's your current level of pain? 0.
The verbal analog scale is often used to get a subjective rating of pain that the patient is experiencing. If the patient is experiencing pain, it's important for this vital sign to also be monitored throughout the session. Gait speed can be indicative of prognosis and ability to function at home and in the community. A patient is considered a community ambulator if their gait speed is 0.8 meters per second or faster. If your patient's gait speed is less than 0.6 meters per second, this is a red flag, meaning that they are at a higher risk for falls. Gait speed of 0.2 meters per second or less indicates your patient will likely be discharged from the hospital to a skilled nursing facility.
At first I was afraid, I was petrified, kept thinking I couldn't do PT with your BP so high. But then I spent so many nights studying exercise and vital signs. Let's get you strong. It's time to walk along, and so you're back from the operation place. I just walked in to find you here with that cyanotic look on your face. I should have checked your O2 stats. I should have made you pursed lip breathe. If I had known those vital signs, you'd still be walking next to me. Go on now, go. walk out the door. Just 50 feet now, 'cause your BP ain't low no more. Weren't you the one who tried to turn away PT? You thought you'd crumble. I said just try it and you'll see those sats are high. You will survive. As long as I know how to monitor, I know you'll stay alive. You've got all your life to live. I've got all my knowledge to give, and you'll survive. You will survive. Hey, hey.